Hi, my name is Laura Edwards. I'm a registered veterinary nurse currently working at Edinburgh University's Dick Vet Small Animal Hospital. Myself and some of my colleagues are here today to show you what it is and what it means to be a veterinary nurse in an emergency and critical care department. We'll be discussing a few cases which you've hopefully already had access to and giving you a good range of the good, the bad and the ugly. Ultimately, we're looking to reach out to the nursing community in the hope we can share some knowledge, debunk some myths, and show what an incredible career veterinary nursing is and what it offers not just our patients, but the wider pet owning community. Hopefully you enjoy it. Here goes. So this slide, I would say, represents what the public think we do. And thanks to everybody who gave me these pictures because they're all fantastic. But I think it's an image which is possibly compounded by the media. It's an image which is often used to encourage prospective students to study veterinary nursing or to study being a vet or just working within the animal sector. However, it's nowhere near the full story. These moments do happen and they are precious, which is why we often take pictures of these moments. Finding pictures, however, of the everyday ICU nursing role is harder to come by, as we don't often want a record of it.
Hello and welcome. My name is Lucy Speak. I'm an RVN working in ICU at the Dick Vet. I'm also a vet physio and hydrotherapist. Today we'll be talking about sepsis due to pyothorax, which was caused by penetrating grass seed foreign body. Bramble was a 6-year-old male-neutered English setter. He had a history of osteoarthritis and was already on long-term non-steroidals for this. The reason for referral was pneumothorax. The diagnosis was septic pyothorax and pneumothorax due to a grass seed foreign body. The treatment was medium sternotomy and right caudal lung lobectomy. Bramble presented out of hours with pyrexia, dyspnea and lethargy. He had already had a unilateral chest drain placed by his own practice. His owner was a vet and upon arrival she was draining 4 litres of fluid off his chest. Bramble had CT scan, IV fluids, analgesia and continuous chest drains overnight. He had a suspected pyothorax and was planned for surgery the next day. A bacteriology and culture of the thoracic sample was done prior to surgery. Here are the pictures from a median sternotomy surgery, including a right lung lobectomy, which is what you can see in the picture on the right hand side.
Hi, my name is Danielle Barrett and I'm one of the emergency critical care nurses at the Royal Dick Veterinary Hospital. Today I'm going to be talking to you about blood transfusions in feline patients, including xenotransfusions. So as most of you know, anemia is the reduction or destruction of circulating red blood cells, or haemoglobin, in acute or chronic manner, which can lead to tissue hypoxia, organ dysfunction, cell death, and in severe cases, patient death. It's considered a clinical sign rather than a diagnosis, as it highly depends on the underlying cause and the severity of the condition. Common clinical signs that can be associated with anemia are pale to white mucous membranes, although this can be masked by jaundiced mucous membranes depending on the severity. Other clinical signs include tachycardia, tachypnea, lethargy, weakness or collapse. There are many causes of anemia in the cat, a few of which I've listed below. So we've got non-regenerative anemia, which is a decreased production of red blood cells due to bone marrow suppression, and causes of this include feline leukemia virus, feline immunodeficiency virus, chronic conditions such as kidney and liver disease, as well as poor nutrition and autoimmune disease. Then we go on to blood loss anemia. That can be seen due to trauma, so that can be your road traffic accidents. Others can include coagulopathies as well as masses and tumours. Then going on to hemolytic anemia, it may be a result of immune-mediated conditions, so it can be classed as a secondary response. You have toxicities, so that can be ingestion of garlic, onion and lead poisoning. You've also got paracetamol. It's a drug that can cause hemolytic anemia and it's not commonly known to be dangerous to feline patients. Incompatible blood transfusions, if they're not typed or cross-matched prior to administration, can also result in hemolytic anemia.
Hi everyone, my name's Lindsay and I'm one of the ECC nurses at the DICVET Small Animal Hospital, and today I'm going to be talking to you about multiple trauma in the ICU, and this is a case of a dachshund versus a horse. So I'd like you all to meet Ted. Ted is an 8-month-old male entire wire-haired dachshund. He was a completely healthy puppy with no underlying medical conditions or injuries, and he presented to our hospital after being found by his owners in a field which had horses in. He was conscious but struggling to breathe, and it was suspected that he had either been kicked or trampled on by a horse. His owners took him to their local practice, where they performed some chest x-rays. They identified a pleural effusion and a pneumothorax. So they performed a single thoracentesis to drain the free fluid in the air, and then sent him on his 2-hour journey to our hospital in Edinburgh for further care. So our triage findings: when Ted arrived, he was quiet but responsive with a normal mentation. He was dyspneic and tachypnic with a respiratory rate of 120 resps per minute. He had dull lung sounds bilaterally, no crackles were audible, and he had paradoxical breathing pattern. He was tachycardic with a heart rate of 170 beats per minute. He had weak matching pulses and pale mucous membranes with a prolonged capillary refill time of greater than 2. He was hypothermic with a rectal temperature of 36.2, and he had a low side of normal systolic blood pressure of 110 millimeters mercury. His SpO2 at this point was 98% on room air. So this is just a quick video. This is clearly not Ted. This is a cat that was hospitalized with ourselves, and it just shows our paradoxical breathing in our patients. So it's the asynchrony between the chest and the abdomen when breathing, and you can just see, instead of the abdomen moving out the way on inspiration, it's getting sucked inwards as the diaphragm moves up with the effort that's involved in inspiration. And this is a sure sign of respiratory failure, respiratory distress in our patients.
Hi, my name is Martina and I'm one of the emergency and critical care nurses at the Edinburgh Vet School. And today I'll be talking to you about septic peritonitis cases in veterinary practice and how we deal with them. What is septic peritonitis? In simple terms, it is the inflammation of peritoneum with the presence of bacteria. And on the picture here, you can see the inside of a dog with septic peritonitis due to perforation of the gastrointestinal tract. As you can maybe see, there is presence of fecal matter within that abdomen. And what are the main causes of septic peritonitis in veterinary patients? Well, mainly it will be foreign bodies, and this is probably more true for dogs than cats. Dogs tend to eat a lot of weird things, things that you would never really expect. Cats are not that bad for it. But for example, in the first picture here, you have a barbecue skewer, so that has been taken out from a dog's abdomen. Second most common cause will be deep ulcers. So gastric or intestinal, they go through the whole thickness of the organ, and the contents spills into the abdomen, causing peritonitis, and most of the time it will be septic. The third cause will be tumors, and these again can perforate, causing the spillage of the contents into the abdomen.